Good morning, friends. Please like, comment, share, and subscribe. And if you have any question, then write your question in the comment box. Today, we will discuss about sexually transmitted disease, also known as sexually transmitted infection. It is used to refer to a condition in which a condition passed from one person to another through sexual contact. A person can contract an STD by having unprotected sex. The organisms, bacteria, virus, or parasites that causes sexually transmitted disease may pass from person to person in blood, semen, or vaginal and other bodily fluids. Sometimes these infections can be transmitted non-sexually, such as from mother to infant during pregnancy or childbirth, or through blood transfusions or shared needles. The most common types of STDs are human papillomavirus, also known as HPV. It is an infection that causes warts in various parts of the body depending on the strain. It is very common sexually transmitted infection, more than 10 million cases in India per year. It requires medical diagnosis. Many people with HPV don't develop any symptoms but can still infect others through sexual contact. Symptoms may include warts on the genital or surrounding skin. The second is genital herpes, a common sexually transmitted infection that is marked by genital pain and sores. It is caused by the herpes simplex virus. The disease can affect both men and women. It is usually self-diagnosable. In this, pain, itching, and small sores appears first. Then they form ulcers and scabs. After initial infection, genital herpes lies dormant into the body. Symptoms can recur for years. The third is the chlamydia. It is a most common sexually transmitted infection that may not cause symptoms. It is affected people of all ages but is most common in young women. It requires a medical diagnosis. A person who is having chlamydia don't develop any symptoms, but they can still infect others through sexual contact. The symptoms may include genital pain and discharge from the vagina or penis. The fourth is the gonorrhea. It is a sexually transmitted bacterial infection that is untreated. It may cause infertility. Regular screening can help to detect instances when an infection is present despite having no symptoms. It requires a medical diagnosis. Its symptoms includes painful urination and abnormal discharge from the penis or vagina. Men may experience testicular pain and women may experience pain in the lower stomach. In some cases, gonorrhea have no symptoms. The fifth one is HIV or AIDS. HIV causes AIDS and interferes with the body's ability to fight against infections. The virus can be transmitted through contact with infected blood, semen, or vaginal fluids. It requires medical diagnosis. Within a few weeks of HIV infection, flu-like symptoms such as fever, sore throat, and fatigue can occur. Then the disease is usually asymptomatic until it progresses to AIDS. The symptoms of AIDS include weight loss, fever or night sweat, fatigue, and recurrent infections. The sixth one is syphilis, a bacterial infection usually spread by sexual contact that starts as a painless sore. Syphilis develops in stages and symptoms may vary with each stage. It requires medical diagnosis. The first stage involves a painless sore on the genitals, rectum. After the initial sore heals, the second stage is characterized by a rash. Then there is no symptom until the final stage, which may occur years later. This final stage can result in damage to the brain, nerves, eyes, or heart.